It started off with hallucinations, thinking that voices were commenting on my situation, delusions of reference, thinking that the TV or the radio had special messages for me. And by my senior year of college, I had become very unwell. I went from a promising scholar to a gravely ill person. It was a terrifying experience. It's hard to fully articulate just how frightening psychosis can be. When I was my most vulnerable and my most ill, my family and community advocated for me to get the care that I needed. Getting diagnosed was a bit of an arduous process. Mental health professionals were unable to quickly and accurately diagnose. For instance, for the lack of biomarkers, they ultimately came to the conclusion that I did in fact have adult onset schizophrenia. With the diagnosis came access to treatment. Once I began taking medicines, it was as if a light bulb went off. After 2 or 3 months, I began to see my condition for what it was, a chronic mental health condition. Fast forward, 8-10 years later, I'm co-chairing, the steering committee for Accelerating Medicine's partnership program on schizophrenia, which is really at the vanguard of developing new treatments for schizophrenia.
The Accelerating Medicine's partnership program is a first-in-class collaboration of the best of the NIH, the best of the private sector, industry and biotech, the best of nonprofits and patient advocates, and the best of academia coming together to solve challenges that none of them could accomplish on their own.
When AMP launched in 2014, the unique partnership felt like a redefined high-risk, high-reward project. It was really unprecedented in its scale with diverse partners.
And the idea was, let's get industry and academics and NIH, and let's get FDA at the table too, and let's pick a disorder that really needs help, and then design together a research plan that we will pursue together and we will pay for it together.
And from the industry side, you had to believe that we were going on an adventure in big team science that was going to raise the bar of disease understanding for all of us.
The common goal at the center of the AMP program is to bring medicines to patients faster in as safe of a method as possible.
The Accelerated Medicine's partnership is ensuring that we take the hardest hitting questions and address them in a collaborative way.
The AMP program has really helped change the culture in medical research, and it represents the best example of team science and really inspires me.
I think AMP as a whole has really made a difference in helping us to take areas of novel cutting-edge technologies and make sure they continue to move forward as rapidly as they can.
One lesson that we learned from the early days of the AMP program is that patient engagement is critical to the success.
By really listening to patients, we learn first and foremost what is important to them. We know that patients with lived experience are the true experts in understanding what is needed to help solve a disease problem or how to attenuate some of the consequences of the disease condition.
The FNH is doing a great job of fostering a culture where I felt heard, I felt dignified, and we all know that helps our healing processes. Now we just need to continue that culture and communicate it to communities.
The real exciting thing about the FNIH and how they operate is that the patient voice is critical to their formula and way of business. Being at the table, we are actually listened to.
I think the greatest impact of the last 10 years of the AMP program has been the volume of data that's been produced by the various AMP projects and the way that that has enabled industry and researchers to prioritize targets that will bring therapies to patients.
We would never have been able to get that kind of effort together without an honest broker to be the convener, and FNIH emerged as the perfect partner to do that.
The AMP program really epitomizes what FNIH is capable of. We serve as a neutral convener.
The vigor and determination with which the steering committees and our FNIH project managers prosecuted these research agendas was what was most inspiring to me.
As I look back over the last 10 years of the AMP program, I really hope that the work that's been done ultimately translates into better outcomes and better lives for patients.
The Accelerating Medicines Partnership is transformative.
It's collaboration.
Exciting and essential.
Is team science on steroids?
Is an imperative for patients.
Is a lattice for success.